It is important to be able to interpret the CSF abnormalities seen in different kinds of meningitis, even though you are not expected to know the normal values. In bacterial meningitis, the bacteria in the nervous system will consume the free glucose in the CSF, driving down that value. There will be more protein in the CSF than usual, and the white blood cell count will be elevated with a neutrophilic predominance. The fluid can sometimes appear yellow or turbid from the amount of pus in the CSF. The opening pressure of a spinal tap will be elevated far above normal. Viral meningitis will often have normal CSF findings. The glucose level will be normal, as viri don't have metabolism and therefore don't consume glucose. The protein count may be slightly elevated, and the white blood cell count will be elevated with a predominance of lymphocytes fighting that infection. The fluid will be clear, and often the opening pressure will be elevated.
Tuberculosis, particularly cases of miliary tuberculosis, can infect the central nervous system. In such cases, CSF analysis will reveal low glucose and, unlike in the other kinds of bacterial meningitis, there will be normal polymorphonuclear neutrophils, but markedly increased lymphocytes. The CSF will be turbid, and the opening pressure will be markedly elevated. Fungal meningitis will often present with normal or slightly decreased glucose, normal or slightly elevated protein, and with an elevated white blood cell count with lymphocytic predominance. The fluid will often appear yellowish and viscous, and the opening pressure will be elevated. This slide lists the organisms responsible for meningitis in different age groups, ordered by epidemiologic frequency. In newborns up to 4 weeks old, the most common cause of meningitis is group B strep, acquired from the mother during or shortly before birth. In children, the most common cause of meningitis is strep pneumoniae, and in older children and young adults in college or group settings like the military, Neisseria meningitidis is most likely. Adults are most likely to have strep pneumoniae as the cause of meningitis, and diabetic adults who are poorly managed are susceptible to the often fatal mucormycosis infection. Elderly adults are also most commonly found to have strep pneumoniae, but they are also susceptible to listeria and aerobic gram-negative bacteria. Immunocompromised adults are likewise susceptible to these organisms, and patients with HIV/AIDS are uniquely susceptible to toxoplasmosis, cryptococcal meningitis, and viral encephalitis from the JC virus.
Any excess volume or pressure within the CSF leads to dilated ventricles, a condition called hydrocephalus. This table highlights 4 types of hydrocephalus. The first type is non-communicating hydrocephalus, which is due to flow obstruction within the ventricles, mostly at points of flow narrowing such as the foramen of Monro. The second type is called a communicating hydrocephalus, which is due to impairment of CSF reabsorption, either at the arachnoid granulations or within the subarachnoid space. The third type is called normal pressure hydrocephalus. It is a chronic process where CSF pressure is usually normal, yet there is dysfunctional absorption by the arachnoid villi. This type of hydrocephalus can produce the classical clinical triad of dementia, ataxic gait, and urinary incontinence. The gait disturbance is typically the first symptom noted. Lastly, there's hydrocephalus ex vacuo, which is relative enlargement of the ventricles due to brain tissue loss or atrophy, as may occur during several conditions, i.e. following stroke, surgery, trauma, advanced age, HIV-associated dementia, or as seen in alcoholism. The ventricles are dilated, yet CSF pressure is normal.
As mentioned prior, CSF drains into the CNS venous system. This image illustrates all of the major dural venous sinuses of the brain. The superior sagittal sinus, which is located in the superior margin of the falx cerebri, drains into 2 transverse sinuses. Each of these drains blood from the confluence of the sinuses into sigmoid sinuses. Each sigmoid sinus exits the skull via the jugular foramen as the internal jugular veins. The inferior sagittal sinus, which is located in the inferior margin of the falx cerebri, terminates by joining with the great cerebral vein of Galen to form the straight sinus at the falx cerebri and tentorium cerebelli junction. This drains into the confluence of the sinuses. The cavernous sinus is a plexus of veins on either side of the sella turcica. It surrounds the internal carotid artery and cranial nerves 3, 4, 5, particularly the ophthalmic nerve, or V1, and the maxillary nerve, or V2, also cranial nerve 6. It drains into the transverse sinus via the superior petrosal sinus and the internal jugular vein via the inferior petrosal sinus. We will reserve our discussion of the central nervous system arterial system until we have a more complete understanding of the various CNS regions supplied by those arteries. Before discussing the central nervous system by regions, let's briefly discuss how the central nervous system maintains biochemical integrity by way of the blood-brain barrier and the blood-CSF barrier. This barrier restricts access of microorganisms, proteins, cells, and drugs to the central nervous system. The blood-brain barrier consists of capillary endothelial cells and the tight junctions between them, which are the most important elements of the barrier. Yet the barrier also includes the underlying basal lamina, astrocytes, and pericytes. Astrocytes and pericytes are found on the outside of the basal lamina, with astrocyte foot processes covering more than 95% of the basal lamina adjacent to the capillary endothelial cells. Substances within central nervous system blood vessels can only cross the blood-brain barrier into the CNS by diffusion, selective transport, or via ion channels. Water diffuses readily across the blood-brain barrier. Similarly, oxygen and carbon dioxide, which are lipid-soluble gases, can readily diffuse across the barrier. Drugs, such as heroin, ethanol, and nicotine, are lipid-soluble compounds and thus can also readily cross the blood-brain barrier. In contrast, glucose, amino acids, and vitamins K and D are selectively transported across the blood-brain barrier. Sodium and potassium ions cross the barrier via ion channels. Lastly, there are active transport systems which are capable of pumping weak organic acids, halides, and the extracellular potassium out of the brain against their respective concentration gradients. Regarding the blood-CSF barrier, tight junctions located along the epithelial cells of the choroid plexus form the blood-CSF barrier. Transport mechanisms are similar to those described for the blood-brain barrier, although the ability of a substance to enter the CSF does not guarantee it will gain access to the brain.